Today, we are going to address how the fast food industry has changed the American diet, how the obesity epidemic has impacted healthcare issues, and the predictions of what the future has to offer. It will also discuss how we, as individuals and as groups, can change our way of eating by consciously planning what we put in our bodies, implementing strategies for entire communities, and using those strategies in order to benefit from these dietary changes. A large share of hamburger supply in the United States comes from culled dairy cattle. Culled dairy cattle, prior to slaughter, has recently been through more than 2 rounds of reproductive aid injections. In layman's terms, steroid hormone injections. Studies have shown these steroid hormones pose a risk to the obesity epidemic through the food supply by disrupting endocrine disruptors into the body. The endocrine system is important because it regulates tissue function, mood, metabolism, growth and development, sexual function, and reproductive processes. It influences nearly all cells, organs, and functions in the human body. Due to the rapid changes in American society, where 1/3 of American mothers with small children are in the workforce, increased the demand for housewife-type services. After working 40 hours a week, the average American family is just too tired to cook a healthy meal for their families, so they spend half of their food budget on fast food restaurants. Hamburger and fries has become America's #1 meal. However, science and technology not only changed what Americans eat, but how their food is made. Today, mass production of frozen, canned, and dehydrated or freeze-dried food is in the center of every supermarket. Giant corporations have taken control of the American agriculture, where rural communities are losing their middle class status and family farms are being replaced with gigantic corporate farms. According to the most recent data, adult obesity rates now exceed 35% in 4 states, 30% in 25 states, and are above 20% in all states. Louisiana ranks the highest at 36.2% in adult obesity. Colorado ranks the lowest at 20.2%. But obesity is not only an American problem. It has become a global problem, with more fast food restaurants popping up in China, Japan, and European countries. Obesity rates are the highest among middle-aged adults, 41% for 40 to 59-year-olds. Nearly 33% of adults who did not graduate high school were obese, compared with 21.5% of those who graduated from college or technical college. More than 33% of adults who earn less than $15,000 per year are obese, compared with 24.6% of those who earned at least $50,000 per year. Approximately 1 in 4 young adults ages 17 to 24 are too overweight to join the military. Being overweight or obese is the leading medical reason why young adults cannot enlist, and the military spends more than $1.5 billion on health care costs and on recruiting replacements for those who are too unfit to serve. Obesity is one of the biggest causes of preventable chronic diseases. And just to name a few: chronic inflammation, metabolic syndrome, type 2 diabetes, cancer, and heart disease. Currently, estimates for these costs range from $147 billion to nearly $210 billion per year. Who is this impacting? Mostly low-income families in African American and Latino communities, and food insecure children, not knowing where their next meal is coming from. Each day, African American children see twice as many calories advertised in fast food commercials as white children. The products most frequently marketed are high-calorie, low-nutritional foods and beverages. Billboards and other forms of outdoor advertisements are 13 times denser in African American communities. As you can see from this chart, blacks and Latinos' rates of overweight and obesity have increased across the U.S. among people of all ethnic and racial groups, all ages and both genders. Among U.S. adults, black and Latino populations have substantially higher risks of obesity than do white populations in both men and women. In order for the change to occur, access to affordable, healthy food and safe places to be physically active need to be in place. Families in predominantly minority and low income neighborhoods have limited access to supermarkets and fresh produce. A study of selected communities found that only 8% of African American residents live in areas with one or more supermarkets, compared with 31% of white residents. To reverse the increasing trends of global obesity and obesity related diseases, an emphasis is needed on dietary patterns that promote human health, increase intake of organic fruits and vegetables, decrease in red meat consumption and saturated fats. Evidence shows a Mediterranean style diet may be useful in preventing and treating chronic diseases, and in order to accomplish this, several things need to happen in order to change these dynamics. A plan needs to be put into action, recommendations and strategies need to take place, and then these need to be implemented in a way that meets the needs and interests of everyone involved. The plan is fairly simple and can be broken down into 4 easy steps. 1. The support of the federal, state, and local levels needs to increase. 2. Standards should be set to limit the amount of advertising when it comes to foods and beverages of low nutritional value. 3. Lower income families need to gain access to more affordable food through nutritional assistance programs, providing information on healthy eating. And 4. Provide increased education regarding healthy choices and how to make these choices more relevant to their daily lives. Strategies to encourage the community to use school facilities for recreational activities before and after school hours. Make healthy foods more affordable and available in all neighborhoods, and these programs should be social, enjoyable, and integrated into daily life and routines. In order to implement these strategies from the outset, a positive partnership with the community must be established. Share the ownership and the goals together. This will allow people to feel pride in their efforts. Make sure the needs and interests of the members are being met. If they are not being met, the plan could fail. You will be amazed what the power of the people can do with a little effort. Not only will people feel more useful, but their health will improve and in turn lower healthcare costs. Having a sense of well-being will not just improve the person, but the community as a whole, and the risk for type 2 diabetes, which is reversible, will be lowered. However, success will require individuals, families, schools, communities, businesses, government, and every other sector of American society to play a role in building an inclusive culture of health in which every person has an equal opportunity to live the healthiest life that they can.